India has become the second worst affected country by the COVID-19 pandemic in the world. With the official data released by the Indian Health Ministry, the country has surpassed Brazil in the total number of COVID-19 cases. India has also recorded its highest surge in COVID-19 cases in the last 24 hours. This is also the highest one-day spike recorded anywhere in the world. Those figures on your screens showing the COVID-19 trajectory in India. In the latest figures, 90,800 people have tested positive for the infection in the last 24 hours. The death toll climbed to over 71,600 after more than 1,000 people lost their lives due to COVID-19 in the last 24 hours. About 700,000 people were tested in that period. Now, on a day when India recorded that highest single-day surge, it also entered the Unlock 4.0 phase. After more than 5 months of being on hold, the metro rail services resumed today. The services operating in 2 shifts from 7 in the morning to 11 a.m. and 4 in the evening to 8 p.m.
We have made all arrangements to make the travel absolutely safe. And it is right decision that now the metro services have been introduced. People were waiting for the metro to start because the metro is the lifeline of Delhi today. And without metro, people were facing very difficulty in traveling. So it is a right decision.
The metro rail services came to a grinding halt on the 22nd of March. However, the restarting of the metro transportation services will now take place in a graded manner. Academic conventions, sports, cultural and religious congregations will be allowed to organize outdoor activities starting the 21st of September. There will also be a limit of 100 persons to be allowed as a part of these gatherings. Use of protective gear, face masks, social distancing norms will be put in place. The Ministry of Union Housing and Urban Affairs also called a meeting of all the managing directors of the metro rail corporations to give out standard operating procedures for the metro services. The average stoppage time at the metro stations will be longer, but the metro train will not stop at all the stations on the route. Metro corporations will be issuing contactless ticketing to limit the spread of the infection. Platforms have been marked for distancing and for the safety of the passengers. The guidelines added that there will be no restrictions on interstate and intrastate travel across the country anymore. Travelers would also not require any separate approval or e-permit from the states to move around the country. And states and union territories have also been directed to not impose any local lockdown measures outside the containment zones without prior consultation with the central authorities. Meanwhile, schools and colleges will continue to be closed till the end of this month. States and union territories will also be allowed to make their own assessment to permit up to 50% of the teaching and non-teaching staff to go to school to gradually kickstart the operations. However, this rule will be applied only in areas outside the containment zones. And these containment zones will be demarcated by the district authorities at the micro level. The health officials will also take into consideration the guidelines of the Ministry of Health and Family Welfare with the objective of limiting the chain of transmission and breaking it. Strict lockdown measures will continue to be in place in all the containment zones. Only essential activities will be allowed till the end of the month. Citizens above the age of 65, people suffering from comorbidities, pregnant women, children below the age of 10 years have all been advised to stay at home except for meeting essential requirements.